Hello everyone, myself Atul and my coordinator name is Abhishek. We are studying in final year B Pharmacy from Shivajirao S. Jondhle College of Pharmacy, Asangaon. Today we are performing presentation on topic drugs used for inflammatory bowel disease under the guidance of Nitin Moire, professor and principal of our college. So here start with the inflammatory bowel disease. As the name it is suggested is the group of disorder that can cause chronic inflammation in intestine. Now one thing you have to remember here, don't have to confuse between the word bowel and colon. So it's nothing. Bowel is the word used for intestine, that is your small intestine and large intestine, while colon is the word that is used for only large intestine. Then, inflammatory bowel disease is comprised in two distinct disorders. First one is ulcerative colitis and second is the Crohn's disease. In ulcerative colitis, it is rarely affect to the smokers, and in Crohn's disease, it is more common in smokers. Therefore, the patient of Crohn's disease are urgent advised to stop the smoking. Second point of ulcerative colitis, it is affect only the large intestine and rectum, and in Crohn's disease it can affect the whole GI tract, in which mouth to anus, and common in terminal of ileum and beginning of colon. As shown in diagram, distribution in ulcerative colitis, it is continuous area of inflammation, and in Crohn's disease the distribution is patchy area of inflammation. Then next, in ulcerative colitis lumen is dilated, and Crohn's disease lumen get narrowed. And in ulcerative colitis it is more common in male, and Crohn's disease which is more common in female. Symptoms: pain in abdomen, diarrhea which is more than 3 weeks, unintentional weight loss and weakness. In pathophysiology, triggering events such as smoking, non-steroidal anti-inflammatory drugs shows dysregulated inflammatory and immune responses in genetically susceptible persons that amplificate the immune response and release the inflammatory mediators, which shows the mucus breakdown and continuous exposure to lumen dietary or bacterial antigen. Hence, result impaired handling of microbial antigen by the immune system and the prolonged time inflammation. Inflammatory bowel disease is diagnosed by physical examination, in that fast heart rate, fever, urgency, weight loss. Next is colonoscopy. It is imaging technique. Then next is upper GI endoscopy. And last is abdominal CT scan. Etiology of inflammatory bowel disease. First is genetic factor. There is about 3 to 20 times higher incidence of occurrence of inflammatory bowel disease in first degree relatives. Then next is immunologic factor, in that defective regulation of immune suppression. Then third is unhealthy lifestyle due to alcoholic consumption, junk food and smoking. And last one is the environmental factor. So let's move towards classification of drugs. First is 5-aminosalicylic acid agent, in that sulfasalazine, mesalamine, olsalazine. And second is immunomodulators. In immunomodulators, azathioprine, 6-mercaptopurine, then methotrexate, and third is glucocorticoids. In that prednisolone, methylprednisolone, hydrocortisone and budesonide. And last one is antibiotics. In antibiotics, methonitrazole and ciprofloxacin. These types of drugs are used in treatment of inflammatory bowel disease. Sulfasalazine, it is a compound which belonging to class 5-aminosalicylate agent. Let's see the structure of sulfasalazine. In that, the compound of 5-aminosalicylic acid with sulfapyridine linked through the azo bond. Then the molecular formula of sulfasalazine is C18H14N4O5S. Pharmacodynamics of sulfasalazine. Sulfasalazine split in colon by bacteria into sulfapyridine and 5-aminosalicylic acid. First we see sulfapyridine. It is rapidly absorbed moiety, which shows no therapeutic action in ulcerative colitis. But the sulfapyridine acts as a carrier that protects the 5-amino salicylic acid from acidic pH of stomach and prevent the absorption from small intestine. Hence, the 5-amino salicylic acid remain unabsorbed moiety, shows anti-inflammatory effect, remission of ulcerative colitis, which reduce the production of cyclooxygenase and lipooxygenase pathway, which result the prostaglandin and leukocortin production decreases, hence reduce in inflammation. That provides the relief only in ulcerative colitis because it acts in colon. Allergic side effect. First is headache, then nausea, fever, vomiting, skin rashes. Then uses of sulfasalazine. It is used to treat ulcerative colitis and also rheumatoid arthritis, which can reduce the joint pain also, and it is also used to treat diarrhea and rectal bleeding. Kinetics. First is absorption. It is absorbed poorly from GI tract after oral administration. Then next is distribution. As per animal studies, have to identify the drug and metabolites in serous fluid, liver and intestinal wall. Then next is metabolism. It is cleaved by the intestinal flora in colon. Then last is excretion. It is excreted through urine and plasma half-life is 6 to 8 hours. Dose is 5 to 1000 mg every 6 to 8 hours per day. Then dosage form are enteric coated tablet. Brand name is azalfadine tablet by Pfizer company. Azathioprine, which is come under the class of immunomodulator. Here is the molecular structure of azathioprine. Molecular formula of azathioprine is C9H7N7O2S. Azathioprine is immunosuppressive medication. It will work by reducing the activity of body's immune system. Pharmacodynamics. Azathioprine is a product that is converted by the hepatic xanthine oxidase to its active metabolites 6-mercaptopurine, that is 6-MP. Then 6-mercaptopurine, which is inactivated by the enzyme thiopurine as methyl transferase, that is TPMT, to inactive non-toxic metabolites 6-methyl-mercaptopurine, and another enzyme xanthine oxidase that catabolizes the inactive metabolite into 6-thiouric acid. Further, 6-mercaptopurine metabolized by the enzyme hydroxanthine guanine phosphoribotransferase, that is HGPRT, into 6-thioguanine 5-phosphate and 6-thioguanine nucleotide are inhibit nucleotide conversion and de novo purine synthesis. Thus, less DNA and RNA are produced for the synthesis of white blood cells, they causing immunosuppressive effect. Side effects of azathioprine are nausea, vomiting, stomach pain, hair loss, low level of WBC, bone marrow suppression. Then uses. Azathioprine oral tablet is used to treat rheumatoid arthritis, and it keeps your immune system from attacking a new kidney after transplant. Then it is also used in Crohn's disease. Pharmacokinetics. First one is the absorption. Azathioprine is rapidly absorbed orally within 1 to 2 hours after administration. The next is the distribution. It is distributed in all tissue but does not cross the blood-brain barrier. Then third one is the metabolism. Azathioprine is converted in liver to mercaptopurine by undefined process. Then last one is the excretion. The parent drugs and its metabolites are excreted by the kidney. Dose 50 mg to 100 mg per day, single dose daily or twice daily. Then dosage form, oral tablet and the injectable solution. The next is the brand name. Immune tablets by the GlaxoSmithKline. Budesonide. It is come under the category of glucocorticoid. Here is the molecular structure of budesonide. Then molecular formula of budesonide is C25, H34 and O6. Budesonide is potent topical anti-inflammatory agent, and budesonide exert a powerful anti-topical inflammatory effect on respiratory and gastrointestinal system. Pharmacodynamics. Budesonide is potent topical anti-inflammatory agent. It binds and activates the glucocorticoid receptor in bronchial cytoplasm that allows the translocation of budesonide GR complex in bronchionucleus, which binds to both SDCA2 and CPB receptor that activates the SDCA2 increase the gene expression, which reduce the formation of cytokinins and TNF cells. It inhibits the activation of the eosinophils by increasing the apoptosis and suppress the activation of inflammatory cells such as mast cell, neutrophils and T lymphocytes. The overall inhibition leads to reduced airway inflammation and hyperactivity, cause the inhibition of bronchospasm and wheezing and coughing. Side effect of budesonide. First is nausea, vomiting, rectal bleeding. Then second is pain or burning when urination. Then swelling in your ankles, and next is increase the acne or facial hairs. Uses. Budesonide is a steroid that reduces the inflammation in body. It is also used to treat mild or moderate Crohn's disease. Budesonide is used to prevent difficulty in breathing, chest tightness and coughing caused by asthma. In pharmacokinetics, first see the absorption. In that, budesonide has first pass metabolism with a minimum systemic absorption. Then next is distribution. The volume of distribution of budesonide is 2.2 to 3.9 liter per kg. Then metabolism. The budesonide is 80 to 90% metabolized by the first pass metabolism, and it is metabolized by 6 beta hydroxy budesonide and 16 alpha hydroxyprednisolone. Excretion. It is excreted by urine and plasma half-life is 2 to 3 hours. Dose 6 mg orally once a day in the morning for up to 3 months. Then dosage form. Enteric coated capsule. Brand name Entocort EC by Perigo Company. Thank you.